When you sign up to do a job, you have to think of the worst case scenarios, and that's why these people are heroes.
Healthcare heroes.
Unsung heroes.
Frontline heroes.
Healthcare heroes.
Frontline healthcare heroes.
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 The government calling us healthcare heroes, that was a joke. You don't treat heroes like that. Heroes are supposed to be on a pedestal, always praising anything that they need, they're supposed to get. Up to now, we're still waiting. We're still waiting.
Working conditions were very bad pre-pandemic. They had been bad for decades. They were working day shifts, evening shifts, night shifts. And the night shifts, it would be not uncommon to have a nurse taking care of 45 residents to one. So for decades, we attempted to improve the working conditions through the typical process of bargaining. So every 3 years, we would attempt to improve the wages, create more full-time jobs, provide better benefits for the frontline workers. And again, there was always, the mandate from the government that they would not even entertain full-time benefits and jobs for the workers. We were there to help. We brought solutions to the minister, and, unfortunately, they didn't go anywhere, and then the COVID came.
It is now official. Canada has its first confirmed case of the new strain of coronavirus.
The World Health Organization has officially called it COVID-19.
COVID-19 can be characterized as a pandemic.
Workers are too terrified to do their job. Are Canadian hospitals equipped to cope as the health minister spells out the worst-case scenario?
So early in the pandemic, when we were being told by our members, the frontline workers, that their co-workers were sick, that they weren't showing up for work, and we would ask the employer, are they infected? Is this COVID related? They would not disclose any of that information to us. We would find out either from the workers themselves, or sometimes even the media would call us and say, we've heard that there's this many infected in this home, or we've heard that there's this number of deaths in the home. When I would ask what are the protections that we're going to be asking of these workers to wear, to share, it was frustrating to hear them say, well, we don't want to mask them up because it might scare the residents. And, looking back now, I think the pandemic itself was the biggest fear to everyone.
I got COVID from work, from the workplace. We had an outbreak at the Grace Villa, an extensive outbreak. By the time the total was done, we had 44 residents pass and 88 staff members that contacted the COVID.
When I got COVID at the beginning of this year, I started crying. Right, working with it and actually having it, it's totally different. And before I went into my house, I was sitting there, my parking spot. I started crying to know that I have to bring this home to my kids. What am I gonna do? How am I gonna deal with it?
When COVID started at my workplace, everybody was kind of afraid and scared. Well, my coworkers started quitting during the pandemic because of the shortness of staffing, and in the horrors and the scars that they've experienced. The people are dying left and right. They don't have time to grieve. When they go home, they can't sleep, they say, because of the trauma that they've experienced until now. So most of them are not there anymore.
My experiences during the pandemic as a home care PSW was basically we were thrown to the wolves. We were the lambs to the slaughters. Nobody would back us up. Management just stepped aside, stayed at home. And we were the ones that had to go out and see our peoples.
So the outbreak was one of the most devastating things I've ever experienced in my life. Before COVID hit, it was a home. Residents are family, staff are family. We used to have big parties, you know, resident parties. My kids grew up coming over and volunteering. It was a home, it was a family. And then the outbreak happened and everything just changed. Like, it destroyed our home. It came in and ripped it apart to a point where there was no fixing it. You know, we had a positive resident, one single person. By the next day, we were up to 5. By the end of the day, it was probably close to 10 to 12. It spread like fire on gasoline. It just ripped through. And by the time I was, you know, deployed up to the 3rd floor, every single person up there was positive. Every single one of them. So the 3rd floor was awful, awful. I walked onto the floor for my first shift and I was just like, what is this? Like, I can't believe this. There was garbage piled up, like piles of garbage, just stacked right at the front of the elevator. There was a table that had all our PPE, so masks, gowns, just piled up on this front table in front of our nursing station. And the hallways were eerie. Like, that's the best way to describe it. Like, there was no life. If I didn't know better, I would have thought it was abandoned. The rooms were dirty. There was food. There was feces in some of the rooms. The toilets were gross. The floors were all sticky. The garbages were overflowing. When a person passed away, funeral home would not come in. They would bring the gurney up to the door. Staff inside would receive it, send it up to the floor. Our administrator had her 15-year-old son working with us up on the unit, and the PSWs and the recreation department. Everyone would wash the bodies, wrap the bodies, and he would take them out. He would take the bodies downstairs for the funeral home director to collect.
There was dead bodies in the room with people that didn't have COVID. Now, if you're dead of COVID, why are you in the room? Diapers wasn't being changed. They weren't being fed. They were dehydrated. They were weak. They were, oh my gosh, it was just hideous in there. I went in there and I spent a half an hour cleaning this one resident's mouth, and I said, if you're gonna die, die with dignity. Don't die with your tongue choking you, because that's not right. I cleaned them out and cleaned them out. There was this huge thing came out from her mouth. I went to the nurse and I said, do you have swabs so I could clean them out? You should see what came out from her mouth. I soaked it and soaked it. Her tongue finally came out from the bottom of her mouth and moved, so she wouldn't choke herself and die. There was people yelling and dying. But the PSWs are the only one are fighting for these people's life. The PSWs are the only one that knows these patients. These residents knows you as their family, the PSW. They gave me a letter on Thursday and said they're firing me because I took picture of the residents. I said I didn't take pictures of the residents. I took picture of the situation. She had maggots coming out of her mouth. There was old food caked in that lady's mouth, that maggot. You could have seen the cranium from a skeleton coming through her mouth. That is terrible in there. There wasn't diapers being changed. The diaper disintegrate into the woman's side. I couldn't get it out. I had to put a new diaper on her with the diaper disintegrate. Come on. People live like this? People take care of our mother and father like this? This is not right. This is crazy.
In theory, we were all prepared for an outbreak. We all knew it was coming, okay? But in reality, absolutely not. Absolutely not. If they were ready, we wouldn't have had so many positives. We wouldn't have lost so many people. What they did wrong is that they waited too long. They never admitted that they needed help. And they didn't give us the staff that we need until it was too late.
Working as a nurse pre-pandemic, it was already stressful. We were working short-staffed. We'd constantly have sick calls. We'd be pulled to other floors, be pulled to the emergency floor without no say to it. But the pandemic really amplified those issues. We'd be working 1 to 5, 1 to 7 as a ratio as a nurse prior to the pandemic, and we were barely holding on. Working as short-staffed feels like you're in a war zone that you're losing. We're already in the war zone fighting COVID in the trenches, and now working short-staffed, it feels like we're losing inch by inch.
At the beginning of the pandemic, I didn't really have a day off for the past 4 to 5 months. You didn't really want to have a day off because you know how it is when you're working short. And I'm not talking about one person short. It could be 2 or 3 people short. So you were doing triple job. And then the residents not getting their meal, their bath, because of short staff.
I work in healthcare. I'm a PSW, but I went to housekeeping. But they were always so short-staffed that I would do my days off in overtime as a PSW, crossing over. Been told that you're not supposed to do that. You know, you're supposed to stay in your lane. But it's like when you're desperate, you're desperate. You know, if they need help, they need help.
We're not able to provide the care that the patients deserve because we have way many more healthcare workers off on sick leave. Staff shortage is very bad right now. I get called all the time to come into work. Even after I just left work, I didn't even make it home yet. I'm being called asking if I can come back. But when your workload is overwhelming and you miss small details, it puts everybody at risk.
Between staff shortages and staff sicknesses, there's now just one nurse for 120 residents at night. Just one personal support worker to toilet, change, bathe, feed, do everything that's necessary for 20 high-needs residents.
Never, ever seen it like this. So bad. I screamed for an hour and a half for help last night. Nobody came.
So the way things are in healthcare now, I'm hesitant to have any hope for the future. We have such shortages of PSWs, especially in home care. There were issues with PPE when the pandemic hit. I called my employer 9 days before it happened because it was getting close, asking if everything was okay, if we had enough supplies. I was told that we did. When the pandemic was declared on March 11th, I found out that we were not in fact fine. We were told we had to wear masks. Under normal circumstances, it should be 1 mask per patient because going into home care, we'd see several in a day. We were told because of the shortages, we had to wear 1 mask all day. Put it in a little paper bag when we were driving from one to the other to help get the moisture out of it.
We had to buy our own equipment. Our masks, resident family was donating gowns. The co-workers even had to turn to garbage bags because, again, they didn't have the proper equipment. It's so sad to know that as managers, to know these things and not do anything about it. But we have to protect ourselves.
Accessibility to PPE was just non-existent. You would come to work, you would get 2 masks. Whether you're working 12 hours, 8 hours, 16 hours, you get 2 masks. And you would only change your mask if they were visibly soiled. Now we still get 2 masks. And on my unit, we get access to N95 mask. But we have to record every time we use how many masks we've used during our shifts. So we would really benefit from accessibility to proper personal protective equipment to just ensure that we are also protected, and we were protecting our patients.
The pandemic caused us to break all these basic infection control policies and standards that we were taught all the way through nursing school and that are secondhand to nursing. To be in the middle of an emergency and not have the masks, the gowns that we needed, and to have an employer not prepared was scary. If a fire was going on and a firefighter didn't have their oxygen tanks or their masks, they wouldn't be sent into a burning building, but we were being sent into COVID rooms and rooms with a mask that had been worn for 8, 10, 12 hours of a shift that were probably worn down and not protecting us anymore.
The workers were terrified of infecting their own families. Getting up in the morning, they would report to me that they would leave the house, look back at their family and think, you know, am I gonna come home safe tonight? Am I gonna come home and make you sick tonight? Again, crying, so fearful for their own families. Some of them stayed and lived in trailers out in their parking lots. Some of them stayed in sheds in their backyard and had their kids bring food to the door and they would pick it up. Some of them said it was like being in jail, but they would do whatever it took to make sure that they did not infect their families.
Living in the trailer it's been of a mixed bag of emotions. It's been nice because I've been close to my family on the same property. I'm at least able to see them and converse with them, although I'm not able to hug my kids or have meals with my kids or tuck them in at night. For me personally, being sort of isolated in the trailer, it's been very strange feeling and has definitely played on my mental health quite a bit. I haven't lived on my own since I was maybe 20. So being that I'm almost 37 now, that's a long stretch to have never been alone, and I'm very, very alone. So on my days off, I'm trying to find things to keep me occupied and keep my mind on things because, again, I can't be with my family. My husband has chronic lymphocytic leukemia, which is a form of cancer that's very slow growing, typically has minimal impact day to day, other than he can be a little bit more tired than usual. And if he gets sick, he gets very sick. So, you know, if my kids and I bring home kind of a nasty cold, my husband will end up with bronchitis or pneumonia almost every time. So bringing home COVID-19 to him and not knowing how that would play with his autoimmune disease is very scary, and it just wasn't a risk I was willing to take because the unknowns are devastating. The idea that I could end up having to raise my kids without him or live my life without my husband is not an idea I ever wanted to deal with or come to understand. There's been a lot of tears, extra sleeping, lots of thinking and kind of getting stuck in my own head a little bit, which has been different. It's a different mentality for me, and it's been very difficult. Very difficult.
I think it could have been better organized, because I think we were about a week and a half to 2 weeks behind on having the COVID in our building, and that's why all of our staff got sick so quickly. Within, 4 or 5 days, 90% of our staff was already positive of having our first COVID positive up on our floor. When we first went into the outbreak at our Anson home, we were basically told we had to self-isolate. So a lot of us decided to come to the hotel to keep our family and our kids and everybody else safe. And we were told from the beginning that it would only be a 2-week self-isolation. Well, that 2-week turned into a couple more days, and I think our testing isn't quite up to par because a lot of us are getting negative, but then 48 hours later, they're becoming positive again. I have a 5 and an 8-year-old. So my 8-year-old kind of understands what Mom is doing and why she had to do it, but my 5-year-old doesn't quite understand, so she's mad at me right now. So it's been tough. I haven't been able to hug or see them in 4 weeks. The mental health, it's real. There's no question about it. You go from being in a normal routine to being stuck in a hotel for 4 weeks. And for me personally, I have my good days, and then there's some days where it's tough, and I am tempted just to escape and go home.
I want to hug my kids all the time. Last night, my husband came to pick up the laundry, and I said, I just want to hug you so bad, and I can't. And it's terrible not being able to hug your kids, or, you know, they don't even, like I said, they don't want to do much with us. They don't even want to come and stop by. This is hard on them seeing us stuck here. And my one son, I give him a hug and a kiss every night before bed, and I can't do that when I'm here.
It was hard. It was just to see what everybody was going through, not only the residents but the staff, that, you know, half of them couldn't even see their family, right? For months upon months, because if you're working there, you weren't allowed to go home, or you didn't want to go home, because if you go home, then you're gonna pass it on to your family members. So it's like months upon months, people didn't see their husbands, their kids, even my kids. I'm a single mom, and the long hours I was working as well, it was hard because I couldn't really show them love, you know what I mean? So yeah, it was devastating when it comes to that, your mental health.
Having to go to work in an environment that is so dangerous and ever-changing has proven very difficult. But dealing with the pandemic and the variants that came, it was never certain if it was enough. Changing my clothes, washing my hands, removing my mask before I walk through the door, not hugging my child when I come home, just constantly being in fear of getting my child sick, even though I kept him home during the pandemic, so homeschool, virtual learning. But it was just that fear in the back of your head when you come home and you know if your child who hasn't been outside, if that child gets sick, no one else did it but you. And it's hard, and you're constantly washing your hands, and you're wondering, did you miss the spot? So, you know, it does something to the mind, and it was very hard, and it still continues to be very hard to deal with that, because you're the person going out there to provide care to people who really need it. It's this ethical dilemma that you're in, whether you're being selfish or selfless.
It affected me in a bad way. I didn't feel competent as a nurse. Like, it affected me. I felt guilty, you know, that I couldn't save these people, you know, and I couldn't do for them what they needed because I didn't have the manpower, and I didn't have the supplies, and I didn't have the support, but I did the best I could. But I felt guilty. Even today, I feel guilty.
You know, working as a PSW, like, we see death, and we're used to death. But honestly, this virus, the way that a lot of them died, it's going to be with us for the rest of our lives. And that's, like, the nightmares, the memories, it's never going to change. Like, these are our residents. This was our second family. And it's definitely going to change how we go forward from here, for sure.
So some of these residents that have gone and got sick with COVID, I'm actually still struggling with a couple of them, because when I left, before I got sick, I knew they were walking, talking, healthy residents. And to hear that they're no longer with us and they died of COVID I can't even wrap my head around it sometimes. It's like, you think of the frail ones, the ones that already have complications that are gonna get it. But there's a couple of that have just, to this day, have just ripped me apart. It's like, how? And then I start feeling guilty going, I got it and I survived. And these people didn't have a chance. didn't have a chance.
The evidence is there that the for-profit nursing homes performed far worse than the not-for-profit homes. As a matter of fact, there was 4 times as many deaths in the for-profit nursing homes than the not-for-profit homes. Places like Orchard Villa had the worst outcome, and yet the premier of the province gives them a 35-year contract after all of those deaths and that poor performance. That doesn't sound like any kind of a plan to take care of the not-for-profit problems. So many of these nursing homes were never held accountable for those deaths, for the mismanagement of the pandemic, for not having proper infection prevention and control protocols, for not having the PPE for their workers. One of the most heartbreaking experiences was listening to Christine Mandagarian's children tell me that their mother, who was a really strong-willed, strong-voiced woman, would come home and tell them how concerned she was that the nursing home was not providing her and her colleagues the proper personal protective equipment.
Christine Mandagarian was just a week shy of her 55th birthday. According to her family, she died doing what she loved, taking care of those who needed her. Mandagarian had worked at the Altamont Care Community Home in Scarborough for more than 30 years when she tested positive for COVID-19 and died earlier this week.
She lobbied them. She literally begged them to provide them with more masks, with N95 masks, with the proper gowns. And they didn't. And her children begged their mom. They cried and pleaded with her not to go back to work until she was provided that safety. Unfortunately, they lost their mother because she would not leave her residents alone and kept going into that building every day, fighting on behalf of herself, her residents, and her co-workers. And she paid the ultimate price for that. Talking to so many of these frontline heroes post-COVID, I'm hearing the call for help. Imagine having to take care and wrap up your grandparent, somebody that you love so much, because the funeral homes wouldn't do it. Imagine seeing some of the conditions of someone that you love choking in bed, choking on their food because they can't breathe. Imagine coming into work in the morning and finding out that 4 people that you loved had died over the night. Don't think for a minute that the mental health crisis that long-term care workers are experiencing is not real. PTSD is definitely what it should be called, because they are experiencing post-traumatic stress.
I wasn't sleeping, I was having nightmares, and I was embarrassed. I didn't want to tell anybody what was going on. So I just said I wasn't feeling well. You know, like I'm not feeling well. But really, I was starting to really go down a dark hole, right? And so I had friends bring me stuff for a month afterwards. Even though I had 2 negative swabs saying I didn't have COVID, I still thought I had it. Was convinced that I had it. How could I not? I worked in, you know, I had one guy cough all over my face and I still didn't get COVID. And yet some of my coworkers were up in the hospital, in the ICU, you know, and I felt guilty. I see my residents when I close my eyes that I couldn't save. And I didn't know how to get over that because I'm a good nurse. I know I'm a good nurse, but I lost so many people. What more could I have done, you know?
I used to hear about mental health, but to say that I've actually went through it too, shocking. Because even sometimes too, I find myself
just crying for no reason, you know? And physically, I'm not, my body's dead. Like, it's dead. I try, like, you know, every day to get up, try to do what I can, the best I can, but at the end of the day, I'm exhausted. My mind is exhausted. My body, like the amount of pains you don't even realize, oh wow, you know, it's catching up. It's really bad. And mental health is a serious thing, a very serious thing. The conversation I've had with my coworkers, I'm surprised I didn't hear any deaths. I'm really surprised. People start drinking more. People start doing things that they don't even want to do, but just to make their mind at ease, to relax their mind. It's really sad. And these people are making money. And then we are their heroes.
We didn't go to work to be heroes. We went to work because we found something that we're passionate about, something that we're good at, and something that brings meaning to our lives and also meaning to the people that we're helping. And just saying I'm a hero or my colleagues are heroes, but not providing us with adequate PPEs, adequate pay to just allow us to make a living is ridiculous. I can't even think of a proper way of explaining it, because just because you call me a hero and then you do something that completely just dismisses everything that I've worked for, that the two don't balance each other at all.
To lose those residents in the speed in which they did, and then on top of that, worrying about your coworkers that are sick, I can't even put the words together as to how that must feel, because you do get close to your residents on a different level. You're in their home every day taking care of them, and to watch them get sick and pass away like that, I can't even I can't even explain how my heart just breaks. It breaks for the members that are getting sick. It breaks for the members that are working in those environments that weren't equipped to deal with something like this, and they haven't been supportive by their management and by the people that own their facilities. And you know, when you lose that many people that you care for, and that it hits a level. We're trained to have this line between ourselves and our patients, or ourselves and our residents, but it's different in long-term care. You know the families, you know their history, you know their stories, and to watch them get sick, I can't imagine how helpless they would feel through that, and how angry they must feel through that. I think about it all the time, and it breaks my heart. We can't lose people like this. Just because people live in term care residences doesn't mean they don't have good quality of life. Doesn't mean that they're ready to go. They're not. Some of them love their lives. They love having their visits. They like the activities. They're social. All they needed was a little extra help, and we failed them. We didn't keep them safe.
So I went from being negative to positive in 48 hours. And in the meantime, thinking I was negative, I was at home with my family, and they were being exposed, because it turned out that I actually was. So my daughter got sick and she was positive. My son-in-law was positive. My grandchildren, thank God, were negative. My daughter got very, very sick. And at that time, my cough started getting worse. And it got to the point where I couldn't get out of bed and be able to breathe. So she said, we need to call somebody. So we called telehealth. And with talking with telehealth, they're the ones that called the ambulance and said, you need to go to the hospital. So they came and I went. And when I was leaving, I said to my daughter, you know, just stay by the phone. I'll call you guys in a few hours. You guys can come get me. And I ended up spending 22 days in there because the breathing got worse and worse. I got the pneumonia. And the infections, they were telling me it's the COVID infection it's a breakdown on your lungs of the fibers, and apparently the damage was greater than we thought. And I probably should have called a couple of days before I did. Within 2 days of being there, they put me in ICU because it wasn't getting any better and the oxygen levels I needed were stronger. And it was just white noise 24/7. 3 days after being in there, it wasn't getting any better. I kept trying to, take the deep breaths. They kept saying, take deep breaths, and, it wasn't getting better. So the doctor came in and told me that I was probably going to have to go on the ventilator. I thought, oh no, I'm done. I'm just, I don't know. Do I talk to my children? How do I say goodbye? Because all I kept hearing, and being in the ICU, people were dying. And I would see them they're not going to close the curtains when they're taking somebody out. And I just thought, because all I ever heard was, once you're on the ventilator, the odds are you don't get off of it. You're gone. And I just couldn't. Because I just knew. So that's why I begged them and just, give me a couple more days. Give me a couple more days. And they listened to me, thank God. And I just said to them, I said, what do I need to do so I don't have to be on this ventilator? I can't do it. I just can't. Then they said, just roll over and lay on your belly as long as you can, as often as you can. And as uncomfortable as it was for 48 to 72 hours, I lived on my belly. If I wasn't sitting in a chair, I was laying on my belly, and my stats started getting better. It still took 4 more days to get out of the ICU, but I did, and ended up going to the COVID floor. After about 5 days or 6 days in there, they let me come home, but I was on oxygen. I had the whole kit and caboodle. They brought me machines and tanks, and I had to have oxygen for 6 weeks. I heard nothing from my head office or from my administrator at all while I was in the hospital. My DOC would contact me and message me and ask me how I was doing. Lots of my coworkers and friends would message me, but nobody, not one person from my head office contacted me. And then when I did get home, I was only home 3 weeks to 4 weeks, and the assistant administrator called me and asked me if I'd be willing to come back into work and do the screening desk on a modified with my oxygen. And me being me, I said, I could probably handle that. I could probably, because I did actually want to go back to work. I wanted to contribute. I wanted to be a part of helping, because things were still horrible there. And I told my doctor, and my doctor literally freaked on me and called them and ripped them a new one and said that she will not be coming back there. I will tell you when she's coming back there. But then a few weeks later, they called me again, the same person, and said, are you feeling any better? Do you think you can handle it? And at that point, I didn't give them an answer. And so here I am. I'm still not working.
A top executive at a company that owns some of the hardest hit long-term care homes has been fired for comments she made after a video conference with families of residents. Joanne Dykeman was fired from her job as Executive Vice President of Operations at Sienna Senior Living. A statement from the for-profit corporation says they have been in contact with families on the call and are deeply apologetic for any pain the comments caused. It goes on to say, while she is deeply regretful of the comments she made yesterday evening, she also understands that they do not meet either her expectations nor those of Sienna Senior Living.
Oh, God. Yeah. I think I did okay.
It is taxpayers' dollar that is going into these for-profit homes. It's public funding that's given to for-profit homes to provide the care, and out of that, those for-profit corporations will skim off some of that money to make sure that the shareholders and the corporations get their profits. Seniors are remortgaging or giving up mortgages. Families are giving up their homes, their parents' homes, to be able to afford care in these homes. It's not uncommon to see a senior have to pay $7,000, $10,000, $12,000 a month to stay in a retirement home, while the CEO of those corporations are making as little as $600,000 and well into the millions of dollars, $3-4 million with total compensation and all the perks that go with that position. While the PSW, who is the person taking care of your loved one, is making $30,000, $40,000 a year.
Already, some provinces, including BC, have banned people from working at more than one facility at a time, all in an effort to stop the spread of the virus.
My job is to provide recreational and social activities for seniors living in long-term care home. My full-time job, I'm a security guard at Princess Margaret Cancer Center. It covers the mortgage, it covers the child support. My second job, which is the recreation programmer, provides the funds to pay my bills, such as the transportation fee, such as my phone bill, TV and internet cable, buy my grocery, and put away for a little saving. So in April the 9th, 2020, that was a Thursday, I had a meeting with my manager and the HR representative. They said to me, open question, the government has put upon us to ask you, you need to choose a workplace. We can guarantee you more hours here, but we can't guarantee you no benefits. And that's the reason why I choose the hospital. So they said, well, then you can't work. This is your last day. We're not laying you off. This is not a layoff. This is that you just choose the hospital instead of a long-term care home. I plead with my manager. I said, my hospital, the cancer center that I work is completely different. I said to them, I do not do patient care. I'm just a security guard ensuring the safety of people coming in and the building. They said, no, you have to go.
I couldn't pay all my bills. Certain things I had to just, I just couldn't do. The main stuff I had to just keep a roof on over my kid's head, myself too, and food in the house. Everything else, I just had to just tough it out. We were getting calls, bill collectors, but after a while, due to the pandemic, people kind of eased back, but you have the 1 and 2 that don't care. So, and I was one of those people that had 2 jobs in 2 nursing homes, and I had to pick one. So it did take a toll. Also, when it came to providing meals for my kids, sometimes I didn't even eat, just to make sure that they get the proper serving, because as a dietary aide, we have to try to follow the Canadian food guide. For me, to tell you the truth, the first pandemic, I lost 25 pounds within that space, 25 pounds, because of all that.
After a couple of long months, they did implement what they called pandemic pay. It was $4 an hour, which of course was helpful at the time. It certainly wasn't enough to meet the, the crisis that they were seeing in the income they were making. And then again, the way that the government rolled it out, again, was so selective. At the first rollout of pandemic pay, it didn't cover all frontline workers, which caused a problem, obviously, to those who weren't given the pandemic pay, but it also caused an internal problem among the workers, that some got it, some didn't. And it was just for a short period of time. It didn't go throughout the pandemic.
So after the pandemic hit and the hours started going down because people being afraid and taking themselves off service or being put off service, my hours went down significantly and I wasn't able to make my bills. I ended up going into debt on one of my lines of credit just to hang on to the house. I looked at my budget, my bills. there was nowhere I could cut because I can't not have electricity or water. I didn't even have cable or satellite. It's way too expensive. And as much as those bills are paid down, I've got things starting to break down in the house. A leak in the roof, other repairs I have not been able to do. Some repairs I can do myself. Certain things I need to hire someone who's certified to do it, such as electrical or plumbing. So that resolved, but I'm still not out of the woods yet because the pandemic pay isn't permanent. And if there's one thing people don't like, especially me, is uncertainty. I'll live with it. But again, I could still lose all of this. And I don't want to do that because I've worked hard for this. It keeps me warm and dry. It's been my lifelong dream, and it could just like that.
I feel sad. I feel being left out. I feel that the society, the government didn't care for workers. We are living paycheck to paycheck. When I pay my bills and pay my transportation costs, I don't have no money to buy grocery. So sometimes I have to go to my mom's or sister's place to get something to eat. Normally I will have oatmeal porridge or some salad because it's going to be strong, so I won't have to eat until lunchtime, and then in the evening I come back and I have some salad again. Because those are the things that I can afford. It is a sad feeling knowing that I could end up on the street, living on the street, because if I can't pay my mortgage, then it means I gotta sell the house and to pay off the house. But yet still, I need a comfortable place. This is my dream home. I have seen my kids since last year, 2019. I talk to them on the phone, but that's not like talking to you face to face. That's not like giving somebody a hug. When you give somebody a hug, you feel that power, you feel that connection. And that's the same feelings you feel that you miss at the nursing home where I work. I feel that if in any way difference I can make to help someone enjoy their life, I'm proud of that, and I feel grateful to be a healthcare worker.
I get joy from helping, and this allows me to do that. So I need them as much as they need me, the way I look at it. And I would love to continue doing this, but with each passing year, it's getting harder. I went through a divorce, which bled me dry. Still paying off debts from that and everything else. And at this point, I'm living with my mom at 41, which is rough. But I can't afford to get out. Not at the wages I'm making. So it's I'm torn because there's a job I love. I'm helping people, making a difference, but I can't even afford my own place. I have a son who's 5, and I got joint custody, but we're sharing a room at my mom's, and that's not where I thought I'd see myself at 41. I'm not asking for, $50 an hour or anything like that, but it'd be nice if I could afford an apartment, a 2-bedroom apartment for me and my son. On a shift I was working, I went into a Tim Hortons and I ordered something, and the lady working behind the counter says, "Oh, are you a nurse?" And I said, "No, I'm a PSW." And she laughed and she goes, "So am I." And she goes, "Actually," and she looks down and to the other side of the restaurant and she goes, "Those 2 down there are PSWs as well." Working full-time at a Tim Hortons, we make more money, less stress, and better benefits. And it kind of made me chuckle as I left, and I thought, is that where I'm heading?
These nursing home employers, they're making billions every year, profiting, but yet still they cannot help us to help our family, to help the residents. The residents are making them make money, but yet still they cannot afford, they don't want to. It's not that they cannot afford it, they don't want to. It's so funny when, I bet you the CEO, if he gets sick, he could bring in a nurse to take care of himself, fine, everything. But again, we can't do that. We can't even get sick time. If you don't have sick time, what are you gonna do?
Well, my life changed drastically after the lung transplant. When I realized that I'm getting sick, first thing in my mind, I was scared, really terrified, because I don't want to give it to my family. I was scared because of them, not for me. And I thought that it's not going to be that serious, because the surprising part is, like, I was one of the healthiest. When I woke up that morning, Sunday morning, I said to my wife, it's really difficult for me to breathe. And I was kind of like walking down the stairs, I remembered. I was calling her, and I said, I knew she was going to say, it's time for me to call the ambulance. And she knows that I'm going to go against it. And she said, well, we don't have a choice. They were hoping that my lungs will heal, but it didn't happen. So it's either, if there's no, improvement after a short span of time, it'll be operation, like lung transplant. That's my only option, or I'll die. I know I'm not the same anymore. I'm not 100%. But the most thing that affected me is because I know that I'm not going to be a PSW anymore. Because I'm immunorepressed. That means I don't have immune system anymore for life. And I'm more susceptible of getting this, any kind of disease. And I'm not 100% physically. And that makes me so sad. Even with the day-to-day life, I'm not as capable of the things that I'm doing. And it makes me depressed, because I can't help out my wife. Without her, I don't know what to do.
The pandemic really is just bringing light to a problem that has always been existing. And I've had a moment where I've worked 16 hours. I'll start working at 7:30 in the morning, finish working at 11:30, and drive home for an hour. And now imagine if I have to come back at 7:30 again, so you're not getting much sleep at all. It definitely takes a toll on your physical well-being. We're still working overtime, double shifts, and those, we're paying for it. Personally, I've paid for it. I ended up with vertigo as a result of my sleeping pattern being disrupted. I'm not sleeping enough. And it's just, those are the type of sacrifices we are making to provide essential cares to those otherwise wouldn't be able to make it.
The little people like us, healthcare workers, no matter what you do, we're the backbone, right? Whatever they're saying, at one point at the beginning, oh, we're the heroes, whatever. You don't treat heroes like how they treated us up to now. Our wages, our benefits, everything. And then try to divide healthcare workers by departments, with the $3 giving PSW, but everybody else nothing. How can you do that? And we all are family. If it wasn't for dietary, how the residents eat, it wasn't for housekeeping, how the place is clean, recreation, every department counts.
Ontario nurses have been on the front line fighting COVID-19 for months now, but many today spent the day marching to Queen's Park, rallying against Bill 124. Workers say it's unfair, gender-based wage discrimination.
Bill 124 is a 1% cap, not only on your wages, but on your benefits. So the ability to negotiate any improvements on those two very important issues means that if you're making $25 an hour, you have 1% of that, which is 25 cents. So you need to decide, are you going to put that 25 cents on your wages, or are you going to take that 25 cents and hope to be able to get the mental health support that so many of these people need after experiencing COVID, so that you can get the support that you need for the PTSD that many of them are experiencing right now. You have to do all of that with 25 cents. COVID gave us the opportunity to open up the blinds and take a real good look at what's happening in the long-term care system. Heroes, yes, but they are a unique human being that replaces us and our love and our care for our seniors, our family members, our aunts, uncles, grandparents. They are so important to society. Caregiving is one of the most important and critical services that predominantly women provide. Bill 124 is one of the most undemocratic, anti-worker, anti-female piece of legislation that I've ever seen. It definitely handcuffs predominantly women who work in the public sector from being able to have the right to negotiate improvements to their working conditions, their benefits, and their wages.
You don't call someone a hero and then turn around and slap Bill 124 in their face. It's contradictory. It's hurtful. Currently, with the inflation rate and Bill 124 in place, we are not making enough at all. I believe the current inflation rate is 4.7% the last time I checked, and saying that you can't increase our hourly wage by more than 1%, that put us at a deficit. It is very expensive to do anything out there. The price of gas is ridiculously expensive. So when you have someone who's literally tasked with keeping you alive, keeping you well, and in the back of their head, they're very concerned about the ability to provide for their families, the ability to just come to work, whether or not they can afford anything at all. It's something that the government can address and should address, and just relieve that stress from us and allow us to provide adequate care to our patients.
I always say, with this line of work, we're not assembling vehicles, we're looking after people. And we need to be paid what we're worth. We need to be treated the way we should be treated and have the support we should have.
I am a home care PSW, but I don't know how much longer I'm going to be in the industry because I can't afford to live. I care about my people, but I can't survive. And the housing to rent is through the roof, and we can't even pay our rents. You take money from Peter to pay Paul, and that should not be. If I am such a hero, why am I dying? And why do I want to leave this profession? I've only been doing it for almost 7 years, and I'm very proud to do it. But lately, no, we're not going anywhere, and they can't get anybody to be hired on to help. We're dying. And that's the way it is.
You can't come back from something like this. No matter how strong you are, you can't. It's like a scar that can never go away. No matter how you go to the doctor or try to, you can't come back.
PTSD is real. And some of these people will never come back from that. And nobody is talking about that. The government's not talking about providing them the support. The employers sure as the heck aren't talking about providing them the help. We owe them so much. In my opinion, there isn't a number big enough that we could give them to appreciate what they've done. And yet they're asking for so little. They're asking for the Canadian dream, to be able to have a full-time job, to be able to raise a family, to be able to put your children through college, and then to retire with dignity. They deserve that.